Hello, and thank you again for joining us today for Maximizing Your Vista Healthcare Benefits. I am Eric Powell, a training coordinator with the Corporation for National and Community Service, and also a Vista alum, and I'll be the host today for today's webinar. I will also be facilitating the live Q&A at the end of the session. Also joining us today are Jeff and Scott from our partners at Education Northwest, who have helped to prepare today's webinar, and they will be managing the WebEx technology. You will also see them in the chat and the Q&A to help address questions that you might have during the session. So let's begin by quickly going over today's agenda. We'll start with a very quick welcome and introductions of our amazing speakers today. We'll go over how you can decide which plan to select. We'll talk about how to enroll in a plan and what you need to know. Of course, you'll want to know how to use your plan, because what good is a plan if you don't know how to use it? And then finally, we'll talk about where and how to access support when you need it or have questions. Let's meet today's speakers. Matthew Nelson is the Program Manager for the AmeriCorps Vista Health Benefit Program at the International Medical Group, known as IMG. He oversees the program's operations to ensure that it is meeting the group standards, as well as assisting in any way to help Vista volunteers get the most out of their benefits. Also joining us, is Kaylee Romovich. Kaylee is an amazing Vista Member Support Specialist in the Vista Member Support Unit. She assists Vista members before, during, and after their service, and answers questions related to benefits, pay, policy, and much more. So to get us started with the presentation, you should now see a poll on the right side of your screen. Please take a quick minute to answer the poll question, and we'll leave it open for a short period of time because it's a quick question and you should know the answer to it by now. The question is, have you enrolled in a Vista Healthcare Plan option yet? It could be yes, the Vista Healthcare Allowance Plan is what you selected. Maybe yes, you've already enrolled in the Vista Health Benefit Plan. Or the answer could be no, I have not yet enrolled in a plan. Or you might be thinking, wait, do I have to enroll? So take a few more seconds to fill out the poll. We'll leave it open for about 20 more seconds. But the information in this poll will help us not only answer more questions on the webinar, but also get a feel for, a lot of you in the chat had posted, some of you are 3 months into your service or 2 months, a few of you are at the very end of your service. But it gives Matthew and Kaylee and myself a good overview of at what stage Vistas know what plan they've enrolled in, have questions, and then we can kind of tailor some of the information to help answer your questions and get you the information that you need, as well as we said earlier, connect you to support and resources so that you are well supported around the area of healthcare. So now that the poll is closed, we'll wait just a second to see what the results are. And I'm guessing most people are going to say A or B, but I could be wrong. Maybe people already have an idea. So the answer's in, and it looks like it's almost an even tie between yes, I've already enrolled in the Vista Healthcare Allowance, or no, I have not yet enrolled. Very few people have enrolled in the Health Benefit Plan, and a lot of people have not answered, which is not a problem. But this will help us go through the rest of the presentation and get answers to, as we said, how do you enroll and what options are there for you. So now that we know a little bit about your status and enrollment, the question that surfaces now is, am I required to enroll? Essentially the question is, do I have to select one of the benefits? First, remember that the Affordable Care Act, the ACA, requires all Americans to have health insurance unless you are exempt. That requirement is completely separate from the Vista program. However, for the Vista program, if you want to participate in one of the 2 healthcare benefits offered through the Vista program, you do need to enroll in a benefit because there is no automatic enrollment. You will select between the healthcare allowance or the healthcare benefit plan. Neither the health benefit plan nor the allowance plan satisfies the individual requirement of the Affordable Care Act of 2010. Well, we know that healthcare can be a very complicated, complex, confusing, and very personal to your own situation. So that's why our amazing presenter, Matthew, is on the phone, and I'm going to ask him now to get us started by reviewing some of the essential terminology related to health so that you understand what it means. Matthew?
Thanks, Eric. Hello, everyone. My name is Matthew, and as mentioned earlier, I am a program manager at IMG who works alongside the Corporation for National Community Service on the Vista healthcare plans. It's a pleasure to join you all today and to help with maximizing your Vista healthcare benefits. We do have a lot of ground to cover, so I hope you don't mind me jumping straight in a bit. Since healthcare and coverage can be a bit complex, at first we may want to start by defining a few key terms that may be important to know. First, on healthcare plans, you will have benefits and you'll have exclusions. A benefit is what a plan includes as a covered service. An exclusion, then, is what a plan specifically says it does not cover for. Next is primary insurance and secondary insurance plans. A primary plan is responsible to always handle a bill first before any other insurance plan. The secondary insurance plan must always pay second after the primary insurance plan finishes handling completely. Usually a secondary plan needs to know the first is done before it can take its turn. Another key term, especially related to the Vista plans, would be pre-existing condition. The definition of this may actually differ for different insurance plans, but generally it just means a condition that existed before a plan began. The health benefit plan will define this as any condition or illness for which medical treatment was given or a diagnosis was made on or before your start of Vista service. It is important to remember that if a condition was diagnosed before you began your Vista service, it can be defined as a pre-existing condition. We'll discuss that more a bit later, but do keep that in mind as you're making your healthcare plan choices. Here are a few more coverage key terms. These are all types of out-of-pocket expenses you may owe for a medical service. A deductible is an amount a plan says you owe before the plan or insurance company will pay for the benefits the plan includes. Usually it's an annual amount. A copay is a fixed out-of-pocket amount a patient owes before services are provided. And last, coinsurance is the percentage of costs of a covered healthcare service you pay after you've paid your deductible, usually. This is similar to a copay, but it's going to be a percentage. So let's use the information on screen here to make an example. So a person's plan has a $2,500 deductible, a $5 office visit copay, and the plan pays at 80% coinsurance. What this would mean is if that person never used their plan at all that year, if they were to have medical services done, at the time of the appointment they would pay their $5 copay. The medical office will then send their bill as an insurance claim to the insurance plan. The plan will apply the first $2,500 it receives in claims to a deductible, which then the medical office will bill the patient for. Once the deductible is met on the insurance side for that year, then the plan will pay the coinsurance rate, which is 80% in this case, and the patient will owe their 20% coinsurance. So that's an example of how you might have coverage and still have out-of-pocket expenses. So now that we have a few key terms, let's decide which plan to select by going over the two options Vista members have to select from. The first option is the Healthcare Allowance Plan. This is a plan for you if you have other coverage under a parent's, a spouse's plan, your own plan purchased through the health insurance marketplace, Medicaid, Medicare, or TRICARE. It will also work alongside your other insurance to pay for any co-pays, deductible, and coinsurance you would normally owe on a medical bill or service after the other plan. So the co-pays, deductible, and coinsurance we just spoke about is what the Healthcare Allowance Plan will help pay for. The other plan available is the Health Benefit Plan. This is for those who have no other insurance coverage and are also exempt from the Affordable Care Act individual mandate that Eric had mentioned. To enroll you, though, IMG will need proof of your exemption. We ask that you provide an exemption certificate number, or ECN, provided by the healthcare marketplace, usually from healthcare.gov. There are also special circumstances to enroll in the health benefit plan where an ECN may not be needed, such as if you're working outside of the continental United States or for those who are part of a federally recognized tribe. If you're not sure about that, please contact IMG for your enrollment and we'll help guide you through. All right, so let's make a quick comparison of these two plans before we go further. So with the allowance plan, you have some form of ACA, Affordable Care Act compliant coverage, and with the health benefit plan, you do not have any other coverage. The allowance plan is secondary to the other coverage. With the allowance plan, your primary insurance will have its own copays, deductibles, and coinsurance fees, but the allowance plan will help by paying for and reimbursing you for those fees. With the health benefit plan, it has no deductible, but does have a $5 office visit copay and a $25 emergency room copay. Don't worry if you don't memorize that. And there's other specific benefits, exclusions, and limitations that can apply. So I recommend if you do enroll in the health benefit plan to make sure to review your member guide or contact IMG. On the allowance plan, there's no network of doctors or hospitals needed, since you will likely just be using the network and doctors under your other insurance plans network. On the health benefit plan, though, since you have no other plans network to use, we use the First Health PPO network. So you want to use the medical providers that are a part of that network. And then the allowance plan can cover pre-existing conditions, but the health benefit plan excludes coverage for pre-existing conditions, with some exceptions. For example, a mental health office visit for a pre-existing condition, you're allowed 3 visits. So please make sure to, again, review your member guide. It is its own policy. It does have its own terms and conditions.
Thanks, Matt, for that great overview of the 2 different plans. So now that you know a little bit more about the 2 plan options, you can think about your own personal situation. So if you know that you do not have a primary insurance plan and you need to get insurance from the marketplace at healthcare.gov, you might be wondering, can you sign up for a Vista plan in the meantime? And the answer is yes. You can enroll in the Vista Health Benefit Plan for 60 days. During this time, we recommend that you log onto healthcare.gov and you apply for primary health insurance. And once you apply for that primary health insurance via the marketplace, you'll be given one of the following results. The first possible result is that you are exempt from primary health care. And when that happens, you'll be given that ECN, or that exemption certificate number that Matthew mentioned earlier. It may also suggest other healthcare options, but if you have that exemption certificate number, you do not need to get primary insurance. Instead, you'll submit the ECN to IMG via their enrollment form, and you'll stay on the health benefit plan. Another possible result is that you are eligible for Medicaid or Medicare. You can enroll in the Medicaid or Medicare plan, and then you will need to submit a new enrollment form to IMG in order to enroll in the Vista Healthcare Allowance Plan. With that enrollment form, you'll need to provide your new Medicaid or Medicare information to IMG. The other possible result is that you are not exempt from having primary insurance and you are not eligible for Medicaid or Medicare, and you must enroll in a marketplace plan. Once you select and enroll in a marketplace plan, you will send a new enrollment form to IMG to enroll in the Healthcare Allowance Plan. You will have to provide the marketplace plan information to IMG via that enrollment form. A helpful suggestion when looking at marketplace plans: you can select the least expensive, high deductible plan, as the Vista Healthcare Allowance will help you pay for that plan's copays, deductible, co-insurance as well.
All right, thank you, Kaylee. And please keep in mind all those options and what could occur with the marketplace, as I'm going to show you now how to enroll in a plan. Now, just allow a moment. We're going to switch to sharing my screen here, and we're going to go to our website of AmericorVista.imglobal.com together. Okay, let's see. I think you should see my screen now. So this is AmericorVista.imglobal.com. We recommend you please make sure to use this website when handling your health benefits, as our regular business webpage of imglobal.com will not apply for Vista volunteers. So make sure you go to AmericorVista.imglobal.com. And you're going to see the first page will greet you and include a few key buttons. A lot of the information we just went over is based on the information from this website. So if you need a refresher later on, come here and click on which plan is right for you. You can also click on My Benefits and Member Resources at the top to get copies of member guides, for FAQs, to search online for a medical provider, and to connect with a telehealth provider, which we will go into more detail later on as well. But your first step as a Vista is going to be to make sure you make your My IMG Vista account by clicking on Member Login. There's two member logins. One's on the top right, one's down here. Either will work. So you see I made an account, but we're going to go ahead and pretend we're here for the first time, and we're going to click on Create an Account. This will bring you here, and on this page, it's going to ask you for your member ID or NSP ID number. Your member ID is what IMG has as your ID, and will eventually be the ID number for your benefits, but if this is your first time enrolling, you likely won't have this yet. Go ahead and enter your NSP ID number provided by Vista, and as the note says here, you're going to want to put leading zeros ahead of the numbers so it's 8 digits long. So for example, if your ID number, NSP ID number was 1, 2, 3, 4, 5, 6, 7, that's only 7 digits long, so you want to go back to the beginning and place a 0. We get a lot of calls for this, so I just want to make sure you're aware. Then enter your date of birth, as shown here, or you can click on the calendar if you'd like to do that this way. And you're going to go ahead and click on Next. Unfortunately, I can't show you the parts after this, but I'll go over them a bit for you. The next page is going to show you your name and just your date of birth and information, just to confirm that it is you that you're making an account for. You'll confirm that, and after that, you can make your own username and password. After you create your account, it's going to take you back to the home page. And once back on the home page, you're going to go ahead and click on Member Login again. And now you can log in using the user ID and password you set up. In this case, we are Jane Doe, and Jane Doe's password is Janie Doe Test. So we're going to click Login. And immediately once you log in, it will bring you back to this page, which goes over again which plan is right for you. And since we've all been doing an awesome job paying attention, we can go ahead straight to the top right where Member Login is, or actually it no longer is. It's been replaced with My Account. And it's now a menu. So go ahead and click on Enrollment. And that's going to take you to the following page here. And as this loads up, bear with me just a moment. This is our online enrollment form. And you'll be able to select all the options we've discussed here today, including the temporary coverage benefits. You can also choose to waive. You'll need to provide your other insurance information or the exemption certificate number we've mentioned. So make sure to have that information ready. But once you finish the online enrollment form, you'll be enrolled immediately. So congratulations, you're all set up. You have your plan. And probably your first stop will be to go to My Documents and print your ID card. And let's see. Also, apologies before we move on. Please don't hesitate to use the live chat function, call or email customer care if you need any assistance with using the website.
Thanks, Matthew. So as you may be aware, a provision of the Affordable Care Act is that once you turn 26, you can no longer be on a parent's health care plan and will need your own coverage. What should you do if you are currently on a parent's plan and you turn 26 during your year of service? So what you'll need to do, you'll need to visit healthcare.gov before you turn 26 or within 60 days of turning 26 to see if you are either 1, exempt from primary health insurance, or 2, if you are required to enroll in a primary health insurance plan. Whatever the result is, whether you're exempt or if you need to enroll in a plan, you will need to submit an updated enrollment form to IMG, either with that ECN, your exemption certificate number, or the new plan information if you have coverage for yourself. Also, when you contact IMG, please let them know the exact end date of the previous plan you were on, basically when your coverage ended on your parent's plan. It might be your date of birth or the end of your birth month. A certificate of credible coverage from your parent's insurance might be helpful. So far, we've covered a lot of information, so let's take a moment to pause. Do you have any questions about selecting or enrolling in one of the Vista health plan options? We're going to talk about using the plan next, so hold on to those questions. But if you have any questions about selecting or enrolling a plan, please add them to the Q&A box on the side of your screen.
I'm seeing some really good questions here. I think I actually just saw one get posted that I might want to address, if you don't mind. I see the question of where can I go to see if I qualify for an exemption or not? That's an awesome question. A lot of the information on whether or not you'll have another plan or whether you'll have an exemption is going to come from usually healthcare.gov. So Eric provided a link to the question answer there, but I recommend if you don't currently have a plan or if you're not currently sure if you're exempt, make sure to go to healthcare.gov, and they're going to be the ones that will help guide you there. Or they might guide you to a state's marketplace as well, where they will help you address that question.
Matthew, in looking at some of the other questions, some of them I think we can answer a little bit later because some of the ones are not quite related to enrolling or selecting in a plan, but definitely good questions for us to answer a little bit later.
Great. These are all wonderful questions.
So now we'll transition to talk a little bit about how to use your plan to access care, and I'll turn it back over to Matt to give a better understanding, since you know a little bit how to select and enroll, how do you actually make use of that plan?
All right, thanks, Eric. All right, so now that we have enrolled, next thing we want to look at is how you can actually use your plan. Do keep in mind, we're speaking about two separate plans as mentioned earlier, so answers for one plan could be a little bit different than the other. I'll try to sort them out as best I can. All right, so when you're finding a provider, you might want to know a little bit more information as well. So when you're using your plans to look up medical providers in your area, it's very important you have an understanding of your benefits ahead of time if possible. You do not want to go out and get a medical service done just to find out only afterward that the type of service you had done was not something your plan can pay for. You will end up being responsible to pay the medical provider, whether it's the physician's office, lab, or facility, for the payment of those medical services. And you getting a surprise large medical bill is not what IMG wants. It's not what Vista wants. We really don't want that for you. So again, if you're unsure or if you have any questions at all, before accessing benefits is a good time to ask them rather than after. I'm just here to help you take best advantage of the benefits offered on these programs. So first, for those of you on the health benefit plan, you will want to search for an in-network provider to make appointments with. So let's speak a little bit about the network. The health benefit plan uses the First Health PPO network. A PPO network stands for Preferred Provider Organization. Essentially, it's really just a list of providers, which are going to be the physicians, hospitals, and labs, all contracted together as part of a group, agreeing to bill and claim at specific rates in that group, and usually to bill directly to the insurance companies or plan administrators that use that group. In general, it's always a good idea to go to providers that are in-network with whatever plan you have. This helps with providers accepting your plan, billing IMG directly for your services, and not asking you to pay up front on your own at the time of the appointment, besides possibly any copays owed. We looked at the website earlier. Under My Benefits is the option Find a Provider, which you can use to use the online search tool to get a whole listing of different types of providers in the area. You even narrow it down by specialty. Also, call IMG. We'll be glad to look up providers for you as well. It's important to let a provider's office know when you're making your appointment what network your plan uses, or really just to let them know how their office is related to your plan, because the person on the other line might not be sure. So if you are on the health benefit plan, let them know my plan uses the First Health PPO network and ask if they accept that. They likely won't recognize IMG or AmeriCorps because we don't directly contract with each of these offices. First Health network does. Once you're at your appointment, make sure to bring your ID card. It has the First Health logo as well, so they should recognize that and can use the information on the back of your ID card to send the bill to IMG. Failure to use an in-network provider or to give their office enough information to recognize they are participating with your plan may mean they bill you up front. I recommend that you have this conversation with a medical provider's office while you're making your appointment, and specifically ask them if they expect you to pay up front or not before you show up to your appointment. Personally, I do this myself when I make my own appointments, since every office kind of has the right to run its business its own way. You will want to know this before you are there and expected to pay. Also, as a reminder, the Allowance plan has no network, but you will likely want to use your other primary insurance plan's network, so maybe this information can help you still. Here are some types of care you might use your plans for. There are many other types of services covered by these plans also, but here's just a few general ones. Preventative care refers to when you are not having any issue, but you go get something medical done anyway, most commonly like an annual physical checkup. If you're on the health benefit plan, it's important to note that routine general physicals are not covered, but a women's wellness exam with a gynecologist is included, and there are some other preventative care benefits included, such as immunizations, like a flu shot. On the allowance plan, you're going to want to consult with your other insurance about that as well. There's also urgent care centers or walk-in clinics, which can be used when you are sick or hurt and not in any danger, but you don't want to make an appointment with a doctor. Really, for the same things you would make an appointment with a doctor for when sick or hurt, but you just want a walk-in clinic, you could go to an urgent care. Also, there's emergency room, and that's going to be when you're experiencing any emergency injury, pain, an emergency illness, and you need immediate care. Never hesitate to contact local emergency services or 911 if you are in danger. Take care of yourself, and then afterward, IMG will do our best to help you out with your benefits once you're safe and healthy.
So we know that you as Vistas are serving all over the U.S., and it might not be possible for you to find an easily accessible healthcare facility in your service area. So what should you do if there are not many accessible clinics or hospitals in your service area? And so in that case, you can use the My Ideal Doctor benefit. This benefit is accessible for those on the health benefit plan and the healthcare allowance plan. It's like a walk-in clinic, but over the phone. It can be useful for common illnesses like colds, flus, and other non-emergency illnesses. You will be able to speak with a real physician about your symptoms, and you even have the ability to send pictures if needed. So maybe you have a questionable rash on your arm, and you could send them a picture so they can inspect it. They can prescribe you medication for pickup at a nearby pharmacy, and you can also schedule mental health counseling services. These virtual or over-the-phone visits have no office copay and are billed directly to your plan. In order to use this service, you would log on to AmericorVista.imglobal.com, the same website where you log into your IMG account. And then at the top, you're going to click on the Connect with a Telehealth Provider link. You can select your plan and create a My Ideal Doctor account, or you may call that number directly and let them know you are with the AmeriCorps Vista program. One important thing to note is that prescriptions are written only when deemed medically appropriate. No DEA-controlled substances, antipsychotics, or lifestyle drugs will be prescribed, and coverage is only available while you are in active service.
And Matthew, before we move on, there's 2 or 3 questions that came in quickly that relate to using a plan that I think it would be good for us to talk about now.
Sure.
One of them is a really easy one. People were asking, are eyeglasses and dental covered as part of these health benefit plans?
They are. Both plans do have vision and dental benefits. Unlike with your medical benefits, you won't need to really go to a network provider if you're on the health benefit plan, but they are included. They are limited though, and I recommend if you're on the health benefit plan, especially on the dental side, to read about what the limitations are for dental. But routine vision is included on both plans. It is capped at $200. And then dental will have a cap of $1,000, but some parts are paid at a co-insurance rate. So do read the health benefit plan if you are getting dental services.
Great. And one other question, which may or may not be easy to answer, is if someone has ACA compliance insurance via a parent, but they, of course, moved across the country to serve as a Vista, and there are no providers in-network in that state, do they just go to the out-of-network providers and will it be covered by the allowance, or what do you recommend that they do?
Yeah, we should be able to assist you with the out-of-pocket expenses. Usually what they do is you might have a higher co-insurance if you go out-of-network, but since the healthcare allowance plan helps you with that higher co-insurance, it should still be okay. Bear in mind, there are really no blanket answers when it comes to health benefits. So I would recommend give us a call, let us look into your specific situation.
And the final question we'll take now, and then we'll move on, is does the healthcare allowance reimburse for medical expenses such as transportation costs to appointments, over-the-counter medications, or knee or elbow braces, et cetera?
That's a good question. Ultimately, the best answer I can give there is, does it generate a medical bill? We would likely need to see it as a medical service to be able to process, that kind of apologies, I'm going to be very specific with my words, but we would need a medical bill showing it's a medical service so we can process it as a medical claim. If it were just, say, a car ride to get to an appointment, say, through either a taxi or Uber, it's possible we may not be able to cover that.
Awesome. Well, thank you. I think that's great, and I think a lot of the questions that are coming in now relate to how to file a claim, and I know you were going to talk about that in a minute, so take it away, Matt.
All right. Well, the next section here is pretty much about, we're getting very specific on the wording of medical bill, medical claim, So let's talk about filing a claim. So now that you did find a provider and a medical service was done, that means there is now a medical bill, and the provider will be needing payment for those services they gave you. Normally, if you go to an in-network provider and ask their office, they will bill IMG directly. Some out-of-network providers, if you ask them, will do that too. If you do receive a bill from a medical provider's office and it doesn't look like IMG did any sort of payment using your AmeriCorps benefits, I recommend giving a quick call to the billing phone number on that bill and just make sure they even have IMG's information. Most of the time, they really just don't even know our address or phone number. Maybe when they took down the information at the office, it didn't get passed on. You calling them and giving them that information will mean that they can bill IMG and you won't be paying out of pocket or being expected to pay anymore. It's important as a patient also that you authorize medical providers to file the claim to IMG. IMG cannot always simply ask for a claim or the full bill from a medical provider. This is because claims contain your private health information, and without you as the patient giving permission, they cannot send that information to anyone. That's part of HIPAA privacy law. So as much as it might be helpful if we were to be able to simply give them a call and ask them, hey, can you send us a copy of the claim? Without you initiating that, they might not be able to. Sometimes we can, sometimes we can't. I would recommend, though, if you are being proactive, give their billing office the call first. In the case that you do end up paying for a medical service on your own, then you will need to file an insurance claim, which is about as fun as it sounds. Bear with me a bit, as this is going to get really specific with the wording, as I mentioned before. And I really do recommending, if you do have to file an insurance claim, call or contact IMG. That way we can walk you through the process. So what's filing a claim really mean? Filing a claim means telling a claims analyst or a claims department, I had this service done on this date, and I believe this service is a part of my plan. And here is the supporting documents to prove that. A claims analyst will then need to use the information you provide, look at your plan, compare them to make sure what you sent clearly matches up to what your plan says it covers. Simply sending them a balance due statement or a cash register receipt saying you paid $200 to a doctor, unfortunately won't give a claims analyst enough information to know what you paid for, and if that thing you paid for is part of your plan. A lot of the time, you won't see what occurs when a medical office sends a claim to your plan on their own, but really what they're doing is they send a claim on your behalf. They are saying, we believe you should pay for this service on behalf of your member and our patient. Here is our proof that you should. Whoever files a claim is responsible for providing proof of their claim, or proof of loss is what the technical term is. It means that they need to include with their bill or claim enough information for the claims analyst to say back, yeah, we agree, you're right, you should pay for that, and then they do pay. With all claims, make sure that you include the following, which are on screen here as well. First is an itemized billing statement, which is going to explain what services you had done, where, by who, when, and how much it cost. This is often a mistake, so I'm going to reiterate, not just a balance due statement or bill. An itemized billing statement is going to need to have some sort of codes, or actually to be specific, procedure codes and diagnosis codes. The bill needs to tell, whoops, I apologize. The bill needs to tell the story of where, when, and who, and what purpose the medical services were done for. Medical offices use codes to do this. So procedure codes are going to be healthcare standardized numbers assigned to every possible medical procedure. It tells a claims analyst exactly what procedures were done. And then diagnosis codes are going to be healthcare standardized letters and numbers assigned to every possible medical diagnosis that tells a claims analyst the purpose of the procedure is done, what diagnosis was treated, or if it was just a routine checkup. Medical providers know these as CPT codes for procedure codes and ICD-10 codes for diagnosis codes. Don't worry, you really don't need to memorize that. Just know that these codes exist. Almost all medical providers should be familiar with what these are. If you're not sure if this is what you have on the itemized bill you're sending, before you file the claim, call the medical provider, or when you're leaving the appointment, ask them for an itemized bill with codes so I can send a claim to my healthcare plan. They'll know what you need to do, and they should be able to give you the right info to do it. Also, if you did pay out of pocket for a prescription drug claim, then you just need to include the detailed pharmacy prescription receipt. I do want to reiterate, though, not the cash register receipt. We need to see the prescription's name and information so we know that the drug that you had filled is something your plan includes coverage for. I promise the rest aren't as complicated as that. The next part is proof of payment, which is any document that shows how and when you paid for service. So usually, here's where the cash register receipt does come into play. That's going to show us you paid and how much you paid for and how you paid for it. Or an invoice that says that patient paid or somebody paid, or a bank statement showing the matching payment, or like a credit card statement showing the payment leaving your account. Or if you did pay via check, a front-back copy of a cash check. I had to pay an ambulance bill via check because I didn't have any other way before, so that's one way I could do that. Proof of payment is needed so that we know you are the person IMG should pay benefits to, and that you actually did pay something and are eligible to be reimbursed. In the insurance world, this is known as making you whole for your loss. You lost money, and they're going to pay to make you whole again so you get that money back. Last, we want all this sent to us with the claim form, which helps us really just organize everything. It lets us know your member name and your information, confirms your address for where we should send payment to, things like that. Those are available on AmericorVista.imglobal.com under Member Resources, and then select Member Forms. The form you use does depend on which plan you're enrolled on. So the Health Benefit Plan has the Health Benefit Plan claim form, and the Healthcare Allowance Plan has the Healthcare Allowance Medical Reimbursement Form. And let's see, next slide. For the Healthcare Allowance Plan, we will need a copy of your other insurance's explanation of benefits letter, or EOB letter. An EOB letter gives the results of the insurance claim. Our claims analyst will need to see the results of the claim with your other plan to know that we can begin handling as your secondary coverage. Remember, we were talking about primary and secondary before. It lets them know how much is owed for copays, deductibles, and coinsurance with your other plan. Also, when we complete any claim for your coverage, you will also get an EOB letter from IMG that lets you know the results. Even if the provider files a claim, you're going to get a copy of an EOB letter letting you know what happens on your insurance coverage. You can view your EOB letters by also logging into your MyIMG Vista account. So that's another good use for that web page. The most important part, though, because those letters, they might look a little confusing, I would recommend you focus on the patient responsibility section, because that's going to be a dollar amount that says you might owe an amount, and the remarks section, which might give information on what happened with the claim. Ideally, patient responsibility will be 0, and you'll see a payment went to a medical provider, or if it went to you, the payment will be attached to the EOB letter. Also, if you do see an amount under patient responsibility, before you do worry too much, check the remarks section again. Then call IMG for help. Most of the time, when IMG is not able to pay on a claim, it's not really a denial. It's really just a request for more information, usually from the medical provider's office. It might not even be from you. We can help you or the medical provider with how to send us that information, and then once we get the new information, the claim will reprocess again and hopefully have a better result. So our last subject for today, though, is going to be how to access support for your coverage. I mentioned a few times during this presentation, reaching out to IMG is probably a good idea if you need help with your benefits. I do know we went over a lot, and I would like to close by making sure to provide you information on how best to reach out to IMG. On screen is our office hours and information. IMG's customer care staff, I feel I should let you know, has helped AmeriCorps Vista members and has been working specifically on Vista's coverage for as long as IMG has been partnered with the program. They know their stuff, and they will be glad to help answer any questions you have with everything we talked about today. You can reach them over the phone or via live chat if you need an answer right away, or if you need information or have a question but it could wait a day or two, save yourself a phone call. Send an email to vistaCare@imglobal.com. We do reply to emails within 24 to 48 hours. To make sure, though, that response is the best, though, if you do send a question by email, make sure you provide your name, your member ID, or NSPID number if you're not yet enrolled. That lets us look up your information so we can actually begin to answer. Also, if you are emailing about a bill or a claim, let us know the date of the appointment or service, the amount of the bill or claim, and if you know the claim number, include that too. To discuss a claim over email, we need to know that, mostly for privacy protection and security reasons. It'll save us having to reply back to ask you for that, and we'll give you the response in 1 to 2 days in the first go. So, I apologize. I know we went over a ton of ground today, so thank you all for your time. And on behalf of IMG, thank you for your service to America's communities.
Matthew, thank you so much for that information, Kaylee as well. We have some questions to answer, but before we get to that, we really want to know what you thought of the presentation. So on the right side of your screen, you will also see another poll where you can share feedback about this webinar. Please take a moment to answer the questions because we really do take your feedback seriously. We want to improve these webinars for the future so that they help us, and more importantly, they help you in your year of service. So now, getting to the questions, as Matt said, we've given you a ton of information to think about, to do research on your own, to figure out what's best for you, and we want to answer your questions. Remember that you can always ask a question by posting it into the Q&A panel on the webinar platform, and I will also invite our operator now to let us know how to ask a question by phone.
Thank you. If you would like to ask a question, please press *1, and you will be prompted to record your first and your last name. Please unmute your phone when recording your name, and to withdraw your question, press *2. One moment, please.
Matthew, the first question is a pretty easy one. So does the healthcare allowance cover your deductible? For example, if someone has a $3,000 deductible and gets injured, would the healthcare allowance reimburse for that deductible?
Yeah. That's the purpose of the healthcare allowance plan will be to pay for the copays, deductible, and coinsurance for qualified expenses on your primary other insurance plan. So that should help with that large deductible. $3,000 is quite a bit.
Yes, it is. The next question is, if someone has their own insurance, but their insurance does not cover chiropractic services, is there an easy answer as to whether or not their chiropractic expenses would be considered an approved out-of-pocket expense, or does it depend on some other situation?
Unfortunately, when it's kind of come to the coverage questions like that, it might not be an easy answer, but specifically in the healthcare allowance plan guide, it does indicate that it should be a qualified medical expense on your other insurance plan, applied to a copay, deductible, or coinsurance. So if it's something that's generally not covered by insurances, I would be wary about using the healthcare allowance plan for that too. There are some listed exclusions in the healthcare allowance guide, so do check that out. But for the most part, if most Affordable Care Act compliant health plans include that service, so will the allowance plan.
Great, and that's for Samantha and Catherine. Both of your questions were similar around that topic. That answer is useful for both of you as well as everyone else on the webinar. And I'll take one more question from the webinar, and then I'll go back to the operator. This question is, if you have a bill during your year of service, but the doctor visit or service was performed before the first day of your service, is that approved coverage or no? So the bill comes during your year of service, but the actual service was performed before the year of service. And I'll quickly answer that one. So with the Vista program, our benefits are only available to you while you're in service. So if you actually did have a service that a doctor visit or some kind of medical expense that occurred before you started your service, that would not be approved as an eligible health care allowance expense because it occurred outside of your Vista service year.
Right. I will add to that. There's kind of another common question that comes off of that too. But first to confirm, the date of service, so really the date of your appointment, is going to need to be during your Vista service term. And then also, let's say on the other side of things, let's say you're ending your service term as a Vista and you had a medical appointment during your service term, but you get the bill after you're already done. You can still file claims for that. As long as the service itself happened between the start date of your Vista service and the end date of your Vista service, you can file claims for the benefits. There is a timely filing limit, but it's actually pretty lenient. It's 2 years. So you want to make sure to get the claim to us within 2 years.
Thanks for that additional information. People do sometimes have questions about that, so that's helpful. Julie, are there any questions that have come in over the phone?
Yes, we do have a question from Leslie. Your line is open.
So I have ACA coverage now for 2018, and I just want to make sure that our term of service as a Vista and the year we're covered through the ACA are not necessarily the same thing. So in other words, if I enrolled for 2018, I might have to enroll in 2019 during open enrollment.
So Leslie, go ahead, Matthew.
No, you, Eric.
Well, I was going to ask a clarifying question, Leslie, to make sure Matt understands it. And my clarifying question was, is your question ultimately asking if you enroll in ACA healthcare, do you have to re-enroll the next time open enrollment is, or is it automatically continuing? Is that your question?
Well, I mean, yes. Yes.
Likely, yes. You'll want to make sure that you maintain your other healthcare coverage. Let's say come 2019, you are placed on a different plan. You might want to send that plan information to IMG also. I did show you the online enrollment form. There is under member resources and member forms also a paper form that you might use later on to give updates about your coverage situation. Or let's say they actually give you an exemption in 2019. You can give us the exemption certificate number at that time and we'll put you on the benefit plan. So it's kind of like, it's kind of the same as if you were to turn 26 in that example we gave earlier, except it's happening at the year end. Do work with healthcare.gov or your local marketplace to make sure you're maintaining your other coverage.
Okay, I just wanted to make sure that this isn't it. This isn't the only time I might have to enroll or check on this. Okay, thank you.
Right, you might need to keep us up to date, and then kind of the other requirements are going to be coming from the Affordable Care Act and any other state requirements or anything else as well. But for our enrollment side at IMG, anytime your coverage changes, keep us up to date.
Yeah, I was just wanting to be sure about the ACA and making sure I was in compliance.
Definitely a good idea because the compliance piece is important, as you said, Matt and Leslie. The compliance piece with the ACA, specifically with the ACA, that's not a Vista program quote-unquote issue, but that's why we have these benefits so that if you have your health care insurance or are exempt, we do have benefits through the Vista program to help you offset those costs. Julie, are there any other questions on the phone?
I'm showing no further questions.
Matt, I see two more so far in the webinar. One is, you mentioned this earlier, how do we get access to the EOB letter to send to IMG?
Oh, sure. So I'm actually reading that question too. I think actually the question reads, my primary insurance does not include dental, so I pay out of pocket. So can I still submit the bill and proof of payment for reimbursement without an EOB was another question. It's kind of all around the same subject of the other insurance and what they do and what to supply for a claim. For dental and vision, those are actually, for the allowance plan, an exception to the rules. Dental and vision do not require having other insurance for the benefits. If you do have other dental or vision insurance, you would use them first as the primary coverage, but the healthcare allowance plan can be primary or work independently for specifically only dental and vision. So you actually don't need to file it to the other plan and get it denied if it's dental or vision, so that'll be good there. The other part of the question was where to get the EOB. You're going to want to contact your other insurance provider. They might have a portal similar to the one I showed you that we provide, where you can print it online, or you can give them a call, ask for a copy in an email. I usually say sometimes with the healthcare allowance plan claims, the other insurance EOB is all we need. We might actually have to hold a claim and ask for a copy. If that does happen to you, give a call to your other insurance plan, ask for a copy by email, and then forward that to vistacare@imglobal.com. We'll get that to the claims department and get that taken care of for you.
Wonderful. And one other question that came in that I see that might be useful, you talked about how to file a claim, and Krista asks, are there any examples of what the support documents for filing a claim might look like? Are there any examples either on the website or a template to make it easier for people to fill them out?
Unfortunately, I don't believe we have an example of what an itemized bill might look like. What might be a good idea, maybe a Google search might show up something like that. There are guides online also for how to file insurance claims that might give you some more information. I apologize, that's not something we do provide though, but we could look into that for the future.
Thanks, Matt. And since we're running out of time, we'll ask one final question and then we'll wrap up. But there was a question about, as a Vista member, is their spouse covered under either of these health benefit plans?
Oh, unfortunately, I hate to end on a negative, but that will not be something that can be covered on the healthcare allowance plan. The healthcare allowance plan will only cover the expenses related to you as the patient. So dependents are not covered, or a spouse in this case.
Great. Julie, any other questions that came in over the phone?
I'm showing no questions.
And I'll turn to my colleagues, Kaylee, Matthew, Jess. Do you see any other questions? Some of them have came in, but it's a little bit slow to access them. Do you see any other questions that came in that we need to answer?
I saw two I want to give an answer to,
okay.
If you don't mind.
Great.
First one was in regards to if the healthcare allowance covers the cost of your other insurance plan's premium. The premium is how much you pay either monthly or periodically to have that other insurance plan. Unfortunately, it does not. So you won't be able to use it to do that. But, and then the other question I saw here is, can you enroll at any time? You do have a 60-day deadline from the start of your service to enroll, but we do accept your enrollment a little bit after that deadline, but I really do want to push you guys to make sure you do this within 60 days. The real deadline is the healthcare.gov marketplace's deadline of 60 days. When you start service as a Vista, you have a 60-day special enrollment period with the healthcare.gov marketplace. IMG won't be able to really assist with that if you let that lapse. So please make sure that if you're new to service and you just started, get in touch with healthcare.gov if you need to, and try to fill out your enrollment with us as soon as possible. Also, if you're feeling like, well, I'm not sure if I really need the coverage right now, the day you get sick, you're going to want the coverage. So make sure if you haven't enrolled already, log on, fill out the online enrollment form, give us a call, email us. We'll be glad to help, and that way, should anything occur, you'll be all set up.
That's a great reminder to everyone else on the webinar about accessing support and the screens we showed earlier about making sure you know how to contact IMG, making sure that you do your own individual research to understand your own personal health care needs and situation, but also sometimes, as Matt said earlier, it also involves you, if you have your own health insurance, whether it's on your own or through a spouse or a family member, also checking with your own health care provider to make sure that you understand the details of your health care plan, because sometimes we've had Vistas who will go to a medical doctor and the doctor accidentally charges them the wrong copay, but the Vista doesn't know the details of their plan, so they get overcharged. And that's why it's really important for you to know how much things should cost, as well as being able to access support. Any other questions? My computer just froze. So any other questions that you see coming in?
I got one more, if you don't mind. The question regarding vision providers and not having to be in network, that is also the case for the allowance plan. The allowance plan does not use a network, so you can always go to any provider for the allowance plan. But if you are using your other insurance, you're going to want to use their providers to make sure that the first claim that goes to them goes smoothly, and then the second claim that comes to us will then in turn also go smoothly.
Great. And Jess, you were about to say something?
Oh, yeah, I see a question or two that might be good to answer. Catherine wants to know, does the healthcare allowance plan pay for a service that is not covered by your primary insurance plan?
It should be a qualified expense on the primary insurance plan per the healthcare allowance plan's terms and conditions in that guide. There are some exceptions. Obviously, dental and vision are the main exception we've discussed so far. One thing that I recommend is if you had an expense or if you really need to get a medical service done and it's not really a question of choice on your behalf, don't hesitate to take care of yourself and do send us a claim. We won't really be able to make a determination ahead of time. We're going to need to look into the specifics of what exactly went on. So that's where the claims analyst is going to need to look at some sort of documentation to know. We'll do our best to give you as much of an idea and educate you ahead of time. So I think in this case, if there is something specific you're thinking about which prompted this question, give us a call. We'll do our best to give you a quote of the benefits ahead of time so you have a good idea.
Wonderful. Jess, did you say you saw another question?
Yeah, there's a question from Kendall, and it's, I think, asking about sort of how you pay for these different plans. And Eric or Kaylee, I think this one might be for you. Kendall asks, will the living allowance cover the cost of a plan, or is that covered by one of the healthcare plans provided by AmeriCorps?
So this is Eric. I'll quickly start by saying the living allowance is mostly meant for your living. It's, it's based at a little bit above the poverty level in the county where you're serving. So the living allowance is not calculated specifically to include the cost of health insurance or health coverage. We have done research over the past couple of years in evaluating the plans that Matthew was talking about to show that most Vistas, when they enter service, are coming into service with their own health coverage or with health coverage through a family member or spouse. But the living allowance is not including additional money for health coverage.
And I think to tag along to that, I think part of the question, if I understood it correctly, was asking if the healthcare allowance plan could help pay to have health insurance, and unfortunately you can't use the allowance plan to pay, you know, that monthly premium of the insurance, but you can use it to pay the co-pays, co-insurance, and deductible associated with that insurance plan. So I hope that combination answered the question, but if not, send us another chat.
And I will quickly add, although it's an extremely, extremely limited circumstance that rarely ever happens but is potentially permissible, is if you're one of those Vistas who happens to be required to have insurance but can't afford it, has exhausted all of your options and issues, and it just still is unaffordable, there is a possibility. If you check with your supervisor, there are some ways that your supervisor could potentially put you on their organization's health insurance plan. However, they cannot code you as an employee. There has to be some kind of a description like a volunteer or service provider, a person involved in service. The reason why I say it's rare is because it almost never happens. Most organizations are not able to do that, but the Vista program does have that stipulation that if you really need help, you can ask your supervisor if there's a way to be put on their health care plan as a volunteer or a national service participant, not as an employee. What else is in? Oh, I do see a question that says, can we file a claim digitally, or is it all hard copies that get mailed in by hand?
Let's see. At the moment, digital claims would be via email. So you can send in a claim to vistacare@imglobal.com. You will want to fill out the claim form. What I recommend, though, is a lot of people have smartphones. You can actually these days just take a very clear photograph on your smartphone, put that on the email. Do just make sure that everything is legible. Look at the picture yourself to make sure everything is very, very clear, and then we'll use that to handle your claim. You can also send it by mail, and then a little bit more outdated and old-fashioned is you can send a claim by fax.
Julie, did you see any additional questions coming in via the phone?
I'm showing no further questions at this time.
Okay. In looking through all the remaining questions, it looks like we've answered just about all of them, unless my colleagues see any that I've missed. But certainly, for those of you still on, if you have questions, we'll be on for another couple of minutes, but also remember you have access to support, and again, looking up your own individual needs so you can make sure that you maximize your Vista healthcare benefit and make it useful for what you need. And just a reminder, I see a few more questions that came in. The healthcare benefits through the Vista program are only available to you as a Vista. They're not available to a spouse or a significant other or a child. It's only available to you as a Vista member. So I think we will go ahead and move towards the end in making sure that we answer the questions, but also keep in touch with the time. So we, of course, want to thank all of you for attending this webinar. As we mentioned, a recording will be posted on the Vista campus in about a week, which will have all the resources and information so that if you have questions or forget what we talked about, you'll be able to access it on the campus. But don't forget that in addition to webinars, we also produce learning resources in other media formats. So keep in mind, check your email, check the Vista campus for occasional announcements about the release of these new resources. You can always go to the webinars page of the Vista campus and click on Connect and Learn to sign up for future webinars and opportunities to engage with other Vistas and our CNCS staff. We, of course, hope to see you again soon. We, again, thank you for attending the webinar. Thank you especially to our expert, Matthew Nelson from IMG, for our partner, Jess and Scott at Education Northwest for managing the webinar platform and the Q&A, and, of course, to Kaylee Ramovich from the VMSU for all the support she gives throughout the year of service. Thank you all for your great service, and we look forward to seeing you soon.